We're here in the Communication Workers Union building on the North Circular Road, and we're launching our published report on the Mater Hospital, which is just a stone's throw from here. The Mater Hospital is an inner city Dublin hospital. It's a local hospital for those of us that live in this part of town, but it's also a national facility too. And our report makes for very interesting reading, difficult reading in parts. It demonstrates a hospital and staff that's working very, very hard, but that is unquestionably under-resourced, that needs very close attention, smart investment and reform too. We're going to put this report online, and I really hope that you will read it. We want this to spark a discussion locally about the services in the Mater, but as part of a much bigger discussion around the Irish Health Service, how to reform it, how to ensure that everybody gets the treatment they need at the time they need it. And that's a big political question. So have a read, have a think, let's have the debate, and let's fix our health service.
I'd like to start by saying fair play to Deputy Mary Lou MacDonald for organising the meeting we just had here. I think it's really important that this document get out to the wider community in Dublin Central, because I think it's important that they can see that Sinn Féin aren't just capable of pointing out where the government have made mistakes, but we actually have answers. That's what we do in the Dáil, that's what we do in our communities, and that's what we will continue to do. It's clear from the research that's being done by Deputy MacDonald that there is a deficit in terms of the resources that are available for the people of North Inner City Dublin, and I think it's clear also that Sinn Féin are the only party that have real and credible solutions that will actually tackle the crisis. We saw recently this week that the Mater is in the top 3 for the worst trolley figures. Those are not the records that we want to be setting. We want the Mater to be a place, an excellent place where people can have access. I think it was very clear from the talk here today that people are very impressed with the staff in the Mater. They're very impressed with the nurses, they're very impressed with the doctors, they're very impressed with the care that they get. The problem they have is access. We cannot get into our hospitals. We find ourselves having to access the hospital through the only door that's open to us, and that's the door of accident and emergency. Sinn Féin wants to change that. We have a credible plan to change that, and we're already making a difference. So when we look at proposals like ours, our proposal for a single integrated waiting list management system, that's been accepted by the HSE. We are not a party of protest and opposition for the sake of it. We will hold the government to account, but we will also put forward credible solutions, just like we have done here today.
How you doing? We're here today at the launch of the Mater document, a Sinn Féin document that was drafted by Mary Lou MacDonald's office. As a local councillor, I was very shocked to see some of the figures in the document. We talked today about the lack of beds, the lack of facilities for patients, the lack of staff. But not only did we talk about what was missing from the health service, we spoke about what's needed. And I truly believe that the plan moving forward from the Sinn Féin team, working with a cross-government support, that we'll be able to deliver a health service that's beneficial to all of our people throughout society.